Good morning, everyone. Happy Monday and welcome. Thank you so much for joining us for House Calls, Real Docs, Real Talk. I'm your host, Chelsea Helms, coming to you live from the KWA News Studio in Fayetteville, Arkansas. Today, we're going to discuss the triangle of risk between type 2 diabetes, chronic kidney condition, and cardiovascular disease. We talk about cardiovascular disease on the show quite a bit, of course, but what some of you may not know is cardiovascular disease is the leading cause of death and a major cause of heart attack, stroke, and heart failure, especially for those people who are living with type 2 diabetes. As a result of this startling fact, the American Heart Association and American Diabetes Association came together to launch an initiative called No Diabetes by Heart in 2018. Diabetes by Heart was created to help raise awareness, educate, and empower people living with type 2 diabetes so they can help better manage their risk. It's a topic very important to the American Heart Association and the American Diabetes Association, but you may be wondering, why are we talking about type 2 diabetes and kidney disease today? Well, people living with kidney disease and type 2 diabetes are 3 times more likely to die of a cardiovascular event like heart disease or stroke compared to people with type 2 diabetes alone. So today we're going to look at what we can do to reset that trajectory. Before we dig in, though, don't forget to hit that share button. There's a wealth of great information ahead, and people who are living with type 2 diabetes and their loved ones and caregivers can really benefit from all this information. Also, throughout the show, we are going to ask you to get involved by answering a few viewer questions. To respond, all you have to do, super easy, text AHA Live to 22333. You can see it there on your screen. AHA Live to 22333. If you don't want to text in, you can simply participate by dropping your answer in the comments section. So super easy for you to get involved with us today. Let's go ahead and get started. With me this morning is Dr. Janani Rangaswamy, Associate Program Director of Medicine Residency at Einstein Medical Center in Philadelphia. Dr. Rangaswamy, thanks for joining us.
Thank you so much, Kelsey. Thanks for having me on the show.
Yes, excited to hear from you today. Before we begin, let's get the audience involved and start with our first viewer response question. We know many people have been scared or worried about visiting their doctor's office during the pandemic. And of course, we have some advice when it comes to that, but we want to know, have you maintained your regular doctor appointments, whether virtual or in person, during this past year? So you can see the options there. We have A, yes, I have gone in person. B, yes, I've had virtual visits, or C, no, I have been hesitant to go. As we mentioned, some people may be reluctant to go to the doctors because of the pandemic, but we are so lucky that a lot of offices are now offering those telemed appointments. Personally, I have maintained going to my doctor's office anytime necessary. Doctor, what would you suggest to people who are maybe leaning towards C as their answer?
I think it's a very important question. And, when the pandemic hit in 2020, there was so much of fear at a community level, at a national level. So, it is totally understandable that patients put their infectious risk first and took some of their chronic medical conditions and put them at the back. However, as the pandemic evolved, one message has been crystal clear, particularly in the area of heart or cardiovascular disease, which is early on, we saw patients not even showing up to the emergency room when they were critically ill, having heart attacks or being, with strokes and, in florid heart failure. And as things started stabilizing, we then saw a new problem, which was a resurgence of all these undiagnosed and untreated heart and other chronic conditions now flooding the ERs and overwhelming hospitals. So my advice would be talk to your healthcare, your physician or other provider, and ensure that their office has appropriate measures in place for you to be seen in person safely. Another alternative would be to schedule telemedicine visits where you can still review a lot of information, blood tests, blood pressure, and other things that you have on your mind. But option C, where you have absolutely no contact with the health system, is harmful.
Yeah, I'm glad to see that a majority of our audience has somewhat maintained their doctor's visits, whether that's been virtual or in person. But we are looking at that percentage there. I think it says about 13% of people who haven't went to the doctor. So hopefully they heed your warning, doctor, and do maintain that contact with their doctor. I do want to take a moment before we move on and say hello to Sonia, who's watching us from snowy Colorado, she says. So thanks for watching us this morning, Sonia. And thanks to everyone else who's joining us. Let's go ahead and move on and get started with health in the headlines. Each week for Health in the Headlines, we select one current headline that ties back to the topic at hand, and we ask our expert to weigh in. This week's headline comes to us from Medical News Today. It reads, COVID-19 and the kidneys, what we know so far. Dr. Rangaswamy, we're learning a lot about how underlying conditions like heart disease, diabetes, and chronic kidney disease impact the severity of COVID-19. So what can people with these conditions do?
I think the first thing is to recognize that having some of these underlying comorbidities, particularly kidney disease, diabetes, and heart disease, can put you at elevated risk and to modify lifestyle and behavior accordingly. So, this has become a daily struggle where people are fed up of, observing all the restrictions and limitations that have been enforced, but particularly patients with these underlying comorbidities have to go that extra mile in their own health interest because if they were to develop infection with the SARS-CoV-2 virus, they are at much higher risk for being in the hospital, for becoming critically ill, needing ICU care, or even death. So I think the second message I would like to put out is those are also exactly the same categories of patients that would immensely benefit from vaccination. So if there's any vaccination hesitancy in those groups of patients, I would urge them again to talk to their own doctors and to other medical leaders in their community and circles so that they are able to protect themselves from those devastating complications.
And there it is again, an important reminder to make sure you are staying in contact with your medical provider there. We're going to move on now to our main segment with live viewer questions, and you ask, we answer. As a reminder, while we're talking today, you can submit your questions in the comments or you can send them to us at heart.org/housecalls. If we can't get to all of your questions during the show today, those questions will get answered during our House Calls after show, which you can find posted on our YouTube channel a little bit later this week. With that said, let's go ahead and get right into it. Our first question coming to us from Nicole in Amarillo. She asks, what are the types of kidney disease? Dr. Rangaswamy, can you break them down for us?
Yes. So there are two separate broad categories in my mind. One is, one I think that people are somewhat familiar with, which is called chronic kidney disease or CKD. What that implies is damage is happening to the kidney from any cause, diabetes, high blood pressure, and other, genetic causes, whatever the cause, but it's happening slowly over time. And usually that kind of damage is considered irreversible. There's another whole category of kidney disease called acute kidney injury, meaning that a person has healthy kidneys at their baseline, but in whatever unfortunate circumstance they are, either they're sick in the hospital with an infection, or they undergo a procedure, or any other stress, the kidneys take a temporary hit. The courses of these two conditions are somewhat different in that patients who sustain acute kidney injury may recover. They may recover fully, they may recover partially, but chronic kidney disease tends to be more indolent. It tends to be slow, but generally more on the irreversible side.
All right, thanks for breaking those down for us, Doctor. Phyllis from Grand Rapids asks, does kidney health have anything to do with heart health? By testing my kidney health every year, does it also reveal other things about my health?
Absolutely. The American Heart Association and other organizations have done a great job of educating the lay public about the important risk factors for heart disease. And this audience is probably familiar with a lot of them. diabetes, which is, central to our discussion today, high blood pressure, being overweight or obese, sedentary lifestyle, smoking, unhealthy diets, and so forth. Interestingly, though, kidney disease, particularly chronic kidney disease, is a very under-recognized risk factor. There's a lot of good literature, and this is not new. This has been known in the medical literature for quite some time that kidney disease is an independent risk factor for heart disease. And as kidney disease gets more severe, that elevated risk for heart disease goes higher and higher. You had mentioned, Chelsea, earlier that there's about threefold of an increased risk for heart disease in diabetics. That risk can go as high as 10 to 20 fold if somebody loses all their kidney function and is on dialysis. So it's a very important thing to know. So yes, knowing details of your kidney function and keeping your kidneys healthy is a very important step that you can take to protect your heart health.
I think that so often, doctor, people forget that everything in there is connected. So we really have to make sure we're taking care of every single part of our body. This next question comes to us from Peter in Minneapolis. He asks, if I develop kidney disease, does that mean I will be on dialysis? A really great question, Dr. Rangaswamy.
Absolutely. And this is the first fear that any patient who comes and sees me in the office has. And the first question they want to know more than anything else is, am I going to need dialysis? And it's the outcome that people fear the most, and understandably so. No, having kidney disease does not mean that, dialysis is in the future of a patient. In fact, the most important job of a nephrologist who is a specialist in kidney disease is to accurately assess the risk and, the degree of kidney disease, meaning how far has the damage happened? Are there things we can do to do some damage control and stabilize kidney function? And what measures can we take to protect whatever kidney function remains so that the patient can enjoy a healthy and full lifestyle without needing therapy such as dialysis? That is the primary goal of being seen and treated by a nephrologist. Now, inevitably, some patients will still go on to develop what is called advanced kidney disease to the point they may need support with dialysis, which is a whole different story. But the goal is to prevent that outcome in the first place.
All right. So the answer is no, you're not just going to walk in and for sure need it. And I think that that's going to be relieving to a lot of people who are watching, and maybe even encourage them to go and get that help that they do need, doctor. We're going to take one more question before we take a quick break. Lucinda asks, I know chronic kidney disease, or CKD, as you've called it throughout the show, is pretty common for people with type 2 diabetes like me. What can I do to protect my kidneys?
I think the first thing is to be aware, which you already are, which is fantastic, that diabetes elevates your risk for kidney disease. In the United States, up to 25% of diabetics have some level of chronic kidney disease. The second is to engage with your physician or provider to ensure that you are getting this monitored. Kidney health monitoring is actually quite simple. It is done with simple blood tests as well as urine tests. The urine test is specifically done to detect something called albumin, which is a type of protein in the urine, and to ensure that we control this adequately to slow down any worsening of kidney function, and also work with your physician to maintain a healthy lifestyle, a healthy weight, good and targeted blood pressure and sugar control. And importantly, also discuss with your physician about some newer medications that have been shown to have remarkable protective effects in reducing not just the risk of needing therapies like dialysis, but also reducing the risk of heart disease.
Yeah, this is definitely a topic that we don't discuss a lot. So I hope everyone is learning as much as I am today. We do have a lot more questions we have to get to, but we're going to take a break for another poll question so that we can hear from all of you who are watching us at home. So go ahead, grab your cell phone and get ready to text in your answer. As a reminder, all you have to do is text AHA Live to 22333 to answer. If you registered at the top of the show and we discussed this, you don't have to do it again. So if you're joining us from your phone, though, and it's just easier for you to drop a comment in the comment section, or drop your answer in the comment section, go ahead and do that as well. So our first question, it's a true or false question. Chronic kidney disease is the leading cause of death for people with diabetes. Like I said, true or false? Chronic kidney disease is the leading cause of death for people with diabetes. While I give you a moment to answer, let's take a look at this video featuring award-winning actress and No Diabetes by Heart ambassador, Angela Bassett.
You've been diagnosed with type 2 diabetes. You have to carefully monitor your health for the rest of your life, and you have an increased risk of developing cardiovascular disease.
Cut.
Type 2, take 2.
Action.
You've been diagnosed with a new purpose, to fight for the amazing life you made for yourself, to look that risk of heart disease square in the face and say, no, not me. You've been given a new opportunity to live. Get started at NoDiabetesByHeart.org.
There's something about Angela Bassett that just makes you want to listen, right, doctor? All right, let's see. It looks like people are already starting to answer. So chronic kidney disease is the leading cause of death for people with diabetes. That's the question we left you with, and we asked you to answer true or false. So far, 100% of the audience saying false. Doctor, did you want to give the answer?
It's what Angela Bassett just said. Cardiovascular disease is the leading cause of death. Now, it's also important to realize that in medicine, it can be a little less granular because, as we just talked about, chronic kidney disease itself elevates cardiovascular disease risk. And this combination of diabetes and chronic kidney disease, regardless of what caused the chronic disease in the first place, is particularly potent in elevating that cardiovascular risk, including for death.
Thank you for explaining that for us. Before we answer some more viewer questions, I do want to remind everyone about the American Heart Association's 10 Under 10 Cook Booklet that was just released this month, just in time for National Nutrition Month. For those of you who want to offer your family nutritious meals, but maybe don't have a ton of time, or you're maybe just trying to stick to a budget, this cook booklet is for you. It features 10 recipes comprised of less than 10 ingredients that cost $10. It includes recipes like oven fried chicken, pot roast, black bean soup, and a chicken curry skillet. So many awesome recipes. If you want to try it out, just go to heart.org/healthy4good to download it. Make sure you go check it out. Like I said, lots and lots of delicious recipes there. All right, let's go ahead and get back to more viewer questions. Doctor, this one comes to us from Blake in Scottsdale. Can I be developing kidney disease and not feel sick? What are the signs and symptoms I need to be looking out for?
Excellent question. What many people don't quite know is that kidney disease, for the large part, is without symptoms or asymptomatic. And that actually is also a problem because that delays the diagnosis because people don't feel sick. People generally tend to seek medical attention when they notice a symptom that's off, or there is a perception that their health is not, you're not fully healthy. But patients can lose even as much as 90% of their kidney function and be completely asymptomatic. And then a lot of the times when the diagnosis is made later in the game rather than earlier, it comes as a huge shock to the patient. And this is also the rationale behind early screening and early detection because, the symptoms here are not helpful as a guide. Now, having said that, when patients lose significant amount of their kidney function and they're very close to the point where they have little left and they're close to the point where they need dialysis, there are some symptoms that the audience should be aware of. Generally, a feeling of unwellness, losing appetite. Patients may not eat well, they may lose weight, they may start getting nauseous, vomiting, bloating because of retention of fluid, shortness of breath for a multitude of reasons. These are all some symptoms, but these are symptoms of very advanced kidney disease. It is really important that we not wait for people to lose 90% of their kidney function before using their symptoms as a guide. So early detection is absolutely the key.
Just fascinating to hear you can lose 90% of the function and still not even know that you're living with that. My goodness, you're right. Early detection seems like the way to go. Taylor from Wichita, Kansas wonders, can kidney disease be reversed or slowed?
Reversibility of chronic kidney disease is tricky because, as I explained, it's a slow process, it's indolent, and these kidneys are slowly getting scarred. Reversing that scar tissue to make it viable is not something where we're quite at yet, although a lot of work goes into, innovative ways to replace that kidney function. However, the other part that you emphasize, slowing down damage, I think that's where the field has really evolved. And we couldn't be living in a better time because we have access now to more than one group of therapies, apart from a healthy lifestyle, blood pressure control, sugar control, weight management, and so forth. There are powerful medicines now that can slow down the progression of chronic kidney disease, reduce the risk of needing dialysis by as much as 40%, while simultaneously reducing the risk of heart failure and death from heart disease. So we live in very important and innovative times where we have so many things we can offer our patients living with kidney disease.
Well, you kind of answered this next question with what you just said a little bit, but Janet in Bowling Green asks, how is kidney disease managed? Are there other options than dialysis?
Absolutely. Dialysis has been an important medical innovation, in the treatment of patients with advanced kidney failure, because before that, patients just died. Many patients are able to lead fulfilling lives even on dialysis, including a growing interest in a field of dialysis called home dialysis therapies, where patients actually are in charge of their own dialysis and lead very fulfilling and functional lives. However, committing a patient to a lifetime of dialysis is not the goal in nephrology. The treatment of choice for people with advanced kidney disease is actually kidney transplantation,
Mm.
which is replacement of kidney function with a kidney from another individual, either dead or living. We've made tremendous progress in the field of transplantation. Outcomes are excellent, and patients with kidney disease should always be aware that this is actually the treatment of choice.
Okay, that is good to know. I bet you a lot of people had no idea. So thank you for informing us about that, doctor. Our final question for the day comes from Albany, New York. Diane asks, what type of test should I ask my doctor for specifically to check my kidneys?
Very good question. The screening for kidney disease, like I said, is actually quite simple, and it's unfortunate that many patients aren't able to advocate to have these things checked when they go to see their doctors. So, when you do go to see your family doctor or practitioner, ask for a blood test called a basic metabolic profile, which includes a blood test that helps estimate your kidney function, as well as a urine test. As I said before, the urine test is specifically to measure this one entity called albumin, which is a protein that is seen especially in patients with diabetes and other types of chronic kidney disease, where the presence of that protein actually causes the kidneys to burn out faster. Good news though, if you do have protein or albumin detected in the urine, there are very, very effective therapies that we can offer to reduce that, even eliminate it, and significantly change the trajectory of that kidney disease.
Doctor, I think one key takeaway from our discussion today is that it's possible to have kidney disease and to not know it. So would you like to reiterate that?
Absolutely. Like I said, many times patients expect that if you have a serious problem, or a serious sounding problem like kidney disease, that they would feel sick in some way. And they take the lack of symptoms as a sign that all is well. Particularly if you are living with a risk factor for kidney disease, especially diabetes, it is really important that screening happen meticulously and regularly. And as I just explained, it's actually quite simple. It's a blood test and a urine test, and also checking in with your doctors to make sure that your risk factors, such as blood pressure, weight, sugar control, etc., are happening appropriately, is really key, so that if there is damage happening, it's known sooner rather than later, because you might be eligible for several game changing therapies that can completely change your risk for the need for future dialysis and other advanced therapies.
Well, and with how simple you say it is, I mean, it really makes it hard to justify not taking the time to do that for yourself, especially if it can mean the difference between, saving your kidneys and not. Well, we are out of time for those viewer questions today, and we do still have some more coming in, so we appreciate those. We have covered a lot today, but before we go, we want to make sure that everyone has learned a little something new. So we're going to play Triple Trivia. Triple Trivia is sponsored by Crazy Cool Science, a campaign that pumps up the fun in science. Science is everywhere, and Crazy Cool Science proves it. We have 3 trivia questions lined up to test your scientific knowledge, all related to today's topic. Drop your answer in the comments section if you're following along with us on YouTube, or go ahead and text in with your answer, and we're going to find out who is on their game today. Here's the first trivia question. True or false? Chronic kidney disease occurs when the kidneys can't filter blood and make urine like they should properly. Okay, I'm going to read that again for everyone who's joining in with us. True or false? Chronic kidney disease occurs when the kidneys can't filter blood and make urine like they probably should. So while we go ahead and give you time to answer, I just want to say thank you so much to Eric Ramirez, who's joining us, and Jamie Sandberg, who's also joining us this morning. We have a lot of people hanging out with us on our YouTube stream watching, and we appreciate that. Doctor, it's looking like so far our audience is saying true. So what's the answer?
Agree. You're right. When chronic kidney disease, the key word is the word chronic, meaning this is happening slowly and over time. But as chronic kidney disease progresses, meaning it gets more and more severe, the ability to filter blood and balance electrolytes, salt, water, and many other chemicals starts getting impaired.
All right. Well, thank you so much to everyone who took the time to go ahead and answer. And it looks like we do have an audience of geniuses today. Our next question, it's estimated how many adults have CKD? We're going to go ahead and pop that next one up for you so you can see your options there. So our options, A, B, C, D. A, 13 million. B, 26 million. C, 37 million. Or D, 54 million. Our question is, it's estimated how many U.S. adults have CKD. So far, we have people answering for 25 million and 37 million. Give people just a couple more moments to answer. With that being said, Doctor, without giving away the answer, will the answer be surprising, do you think?
Yes, I think because the number is significantly underestimated. As we talked about, if you think about diabetes itself, we have 34 million people in America alone living with diabetes. 1 in 4 of healthcare dollars are spent on diabetes, and about a quarter of those just have kidney disease from diabetes only. There are also a large number of patients that have undiagnosed disease. And when you add that along with what we know, it's a very, very big number and usually underestimated.
Well, it looks like most people, I think it says about 57% of our audience, now 63% has jumped up to, are saying 26 million is the answer. Are they right?
It's approximately, around that ballpark. But like I said, it's these numbers sometimes have to be, taken with a grain of salt, because a lot of what we know, there's a large part of disease that is also not diagnosed or underdiagnosed.
So then we'll have to give it to those who answered B and C, because it's about between there. All right, our last trivia question for the day, true or false, diabetes cannot affect the risk of CKD or chronic kidney disease. True or false, diabetes cannot affect the risk of CKD. Look, people better been listening to us. This should be a gimme, right, Doctor?
Absolutely.
All right, go ahead and answer the question when you have a moment to, everyone who's watching us. And there it is. Doctor, you want to speak to this?
Yes, everybody did really well on that one. And I think that was the take-home message. If there's one message you want to send out from this discussion, it is that diabetes significantly increases the risk of chronic kidney disease, and the combination of having kidney disease with diabetes in turn significantly elevates the risk for heart disease.
Yes, absolutely the takeaway for the day. That is it for trivia. We appreciate everyone for joining in on the fun, and I hope we were all able to learn something new from it as well. Dr. Rangaswamy, thank you for joining us today and helping us learn so much on this topic. Is there anything else that you'd like to add before we say goodbye to you today?
Thank you so much, Ferris, for having me on this. It's a pleasure to always educate the audience and the community about this, the triad of heart disease, diabetes, and kidney disease. I think the message I would like to share is that knowledge is power. And as we've just talked about, we have a lot of tools in our armamentarium to treat these conditions early and alter the course and some of the future devastating complications with untreated disease, whether it's diabetes, kidney disease, or heart disease. But again, early detection is the key. A lot of salvage can be done when we know what we know about a patient, but if we see patients with advanced or end stage disease, then many of these therapies may not be that effective, or worse, these complications have already been sustained. So, like I repeat, I want to emphasize knowledge is power, get screened. The pandemic is not a reason to not get healthcare. You may have to get it in a modified way, in a modified setting, but knowledge of your risk factors and risk factor control should happen through the pandemic and after to keep you healthy and well.
You have absolutely drilled home so many fabulous points today, Doctor. We thank you for joining us, and thank you to all of you for watching. That does it for our show. You can find any of our previous shows at heart.org/housecalls. And for more on the connection between diabetes, heart disease, and stroke, visit knowdiabetesbyheart.org. One last thing, do not forget to register to get your COVID-19 vaccine. We've covered the vaccines in our last 2 episodes, so if you're looking for more information, we encourage you to go watch those. The vaccine is safe, effective, and it's our best shot at getting back to the thing we love and doing the things we love with the people we love. I'm getting mine today, actually, so I'm very excited to get my first dose of the Pfizer vaccine, so I hope all of you will join me in doing so. Thank you so much for tuning in this morning. Once again, I'm Chelsea Helms. I'll see you all next week. Have a great Monday.
Getting back to this, to her, to family, to friends, to hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org.